I'm Dr. Schroder. I'm a general surgeon with Advanced Surgical Partners of Virginia. A small bowel obstruction is when the bowel inside your abdomen gets kinked, kind of like the hose in your yard gets kinked, and water will either pass slowly through it or not at all. Small bowel obstructions occur commonly in patients who have had previous surgery, such as gallbladder surgery, appendix, total abdominal hysterectomy, or some type of bowel surgery. The symptoms of a bowel obstruction at first may not be very serious or even concerning to the patient. Patients may have crampy abdominal pain, but eventually everything goes through and they have normal bowel movements. Not infrequently, though, patients will develop crampy abdominal pain that goes on to nausea, vomiting, and abdominal distension. These are the characteristic signs of small bowel obstruction. Once these symptoms occur, you should be seen by your primary care physician or go immediately to the emergency room for treatment. Most small bowel obstructions can be treated conservatively. These are treated with an NG tube, which is a small, thin tube that has an opening on it that is passed through the nose into the stomach to allow contents to be evacuated from the stomach and allow the bowel to unkink, kind of like the hose in your yard gets unkinked and water then goes through it. With an NG tube in place for approximately 24 to 48 hours, most patients will see improvement in their symptoms, less distension, their nausea and vomiting will go away, and they will start to have bowel movements. At that point, the NG tube can be clamped or removed, and the patient can start a diet, usually clear liquids, and be advanced back to regular food without difficulty. Often, the small bowel obstruction will not reoccur, and patients can go on and live normally without any issues. Unfortunately, sometimes the bowel obstructive symptoms will recur, which means they'll get the nausea, the vomiting, and abdominal distension back. When this occurs, even with an NG tube and decompression of the stomach, sometimes the symptoms will not go away or could even get worse. In this instance, a patient will require surgery to unkink the bowel, which is usually due to adhesions from the previous surgery. Often the surgery can be done laparoscopically using small incisions to look inside the abdomen with a TV and a camera, find the area where the adhesions are causing the kink, cut those adhesions, unkink the bowel, and allow the patient to return to normal activity and a normal diet. With laparoscopic surgery, the incisions are smaller and there's less pain. As a result, patients can go home earlier, get back to a regular diet quicker, and get back to normal activities and even work in a timely fashion. Unfortunately, sometimes laparoscopic surgery cannot be done to correct the bowel obstruction. This means that an open incision has to be used, usually through a previous incision if the patient has had previous abdominal surgery. With the open technique, we go in with our hands and we cut the adhesions and scar tissue that may be causing the bowel obstruction. With an open procedure, however, the recovery is much longer. It's usually a few nights in the hospital, and recovery once you go home is a little bit longer. Instead of being able to go home earlier, have less pain, and get back to normal activities quicker, your recovery may take 2 to 4 weeks to get back to light duty, driving, and normal activity around the house. Most patients are not able to do any heavy lifting until 6 weeks, and even then we want you to be very careful due to the risk of developing an incisional hernia. So in summary, patients who have had previous abdominal surgery should be aware that small bowel obstructions can occur. If you start having symptoms of belching, bloating, abdominal distension, or even nausea and vomiting, you should see your primary care physician for evaluation. If these symptoms become worse, though, you should definitely go to the emergency room for immediate evaluation.